Hi, my name is Dr. Ellen Joseph, and I'm a clinical health psychologist and partnership liaison at GI Psychology. I'm excited to have the opportunity today to talk to you a little bit more about psychological treatments for gastrointestinal disorders and ways in which GI Psychology will be able to help you on your path towards relief. GI Psychology is a fully telehealth national practice. We see patients ages 6 and above, although sometimes younger if appropriate, in all 50 states, including Washington, D.C. Our one-of-a-kind practice is focused on being a resource to gastroenterologists and patients like you across the country. We provide empirically backed gut-brain therapy for patients with disorders of gut-brain interaction and inflammatory bowel disease, as well as chronic pain and other medically complex issues. All of us at GI Psychology value partnering with GI practices across the nation to increase access to care and help improve holistic care for patients with GI conditions. Some of our largest partnerships include the American College of Gastroenterology, the Crohn's and Colitis Foundation, MedStar Georgetown University Hospital, Scripps, and Mayo Clinic in Jacksonville. And there are even more. We're actively working to build partnerships across the country. To better understand how a gut-brain therapist can support you with your GI concerns, let's talk a little bit more about the gut-brain axis and how this can lead to DGBIs or disorders of gut-brain interaction. Our brain and our gut are constantly in communication through our central nervous system, which includes our brain and our spinal cord, and our enteric nervous system, which includes our gut. This communication system cannot be seen in lab work or through scopes. And these parts of our body are constantly talking to let us know when we're hungry, when we're full, when it's time to eat, when something problematic is in our stomach, like a virus. And this communication system can become faulty for many reasons, like genetics and infection, chronic stressful life events, or even constipation and diarrhea. As a result, our brain becomes more reactive to and distorts normal signals in the gut or the GI system, resulting in the experience of increased pain and discomfort. And this is called visceral hypersensitivity, which together with our brain constantly scanning for gut-related issues, which is called hypervigilance, results in a vicious cycle of pain and worry, potentially causing a disorder of gut-brain interaction or a DGBI. Two research-supported treatments we utilize are gut-directed cognitive behavioral therapy and clinical hypnosis. So when we think about hypnosis, it's important to distinguish between the two kinds, entertainment hypnosis and clinical hypnosis. So unfortunately, most of us only know about entertainment hypnosis. Think about performances where people are hypnotized and made to do embarrassing things like quack like a duck on stage. Clinical hypnosis is very different from this. For this, you go into a trance on purpose, not accidentally. And trance is simply a combination of concentration and imagination, and actually something that happens really naturally in our lives, like when we're exercising, playing a sport, when we're scrolling on our phones, watching TV, or driving to work. And during this trance, your therapist uses suggestions which are targeted to address your specific concerns. What's important to know is that you have complete control and will not do anything that you do not want to do or wouldn't do outside of trance. In fact, many people actually report feeling more in control because they decide what to do and what not to do based on suggestions provided by the therapist. Each person has a different level of hypnotic talent, which means how easily they fall into trance. However, most people have enough hypnotic talent to participate in hypnosis. You don't have to be a master or an expert to get benefit. Years of research exist for these treatments, especially for DGBIs. In fact, these treatment approaches are backed by the Rome Foundation and the American College of Gastroenterology's clinical guidelines. Through our practice, we have helped hundreds of patients just like you. In fact, 8 out of 10 patients reach their treatment goals, and you can be one of those people. So GI Psychology is an out-of-network provider for insurance, which means we do not accept any insurances. We do provide super bills on a regular basis to patients if they are interested in submitting those super bills to be reimbursed using their out-of-network mental health benefit, specifically for commercial insurances. So this does not include Medicaid or Medicare. In terms of costs for treatment, we see folks coming to us specifically for concerns with a GI condition only. We see that they require an average of 13 sessions, although this can vary depending if you have a variety of concerns that you want to work on. We have the flexibility as therapists to make sure that you're getting exactly what you need to meet your treatment goals. It costs $325 for the intake appointment and $250 for each subsequent appointment. We do have a couple lower cost options. We offer a 4-week GI skills workshop, which is a foundational GI skills workshop where we aim to learn more about the gut-brain interaction and some foundational coping strategies for living with a GI condition, as well as engage in some experiential exercises. And we also support folks with obtaining a single case agreement or gap exception with their commercial insurance if they wish. So with the support of our admin team, we help you to seek out the single case agreement through your insurance, where our services will be covered as if we were in network on a reimbursement basis. And you can talk a little bit more with our admin team if you're interested in exploring this option. And here are the best ways to get in contact with us. You see our email address. This is our admin phone number, as well as their email, as well as our contact us form. You can sign up for a free 15-minute phone consultation where you meet with a member of our admin team to talk a little bit more about your concerns and what you're looking for out of treatment to decide if GI psychology is the right fit for you. We as a team really look forward to meeting with you and figuring out how we can help you experience relief and be on that road to recovery. Take care.